Okay, the visceral pericardium or the epicardium is the outer layer of the heart that keeps it moist. Um, this is the apex. Can you see? This is the apex of the heart. This is the base of the heart. The right and left atria are right around here. This is the right atria, left atria. The auricles, these are the flaps. I might cut mine, but these are the flaps that peek over the sides. The right and left ventricles. So this would be your, let me do it this way. So this would be the right ventricle and this would be the left ventricle. I'm sorry, and the atriums are, the right atrium is deoxygenated and the left atrium is oxygenated. The auricles are used to expand the surface of the heart when they're filling up with blood. When it's filling up with blood, when the atria are filling up. The intraventricular sulcus is right in this area here, which divides these two ventricles, and it has the coronary artery and the cardiac veins. The pulmonary trunk is gonna be, it's kind of hard to see, but it would be this back, oh I'm sorry, it'd be this area here. My heart has a lot of fat on it. The blood is going from the heart to the lungs, and it is deoxygenated. The aorta is this big hole on the top here, the largest hole on the top, and the blood is going to the aortic valve, and it is oxygenized by this time. The ascending aorta is, we can't see it again, but it would be like right around here. And the aortic arch would be the arch that is what kind of hugs the aortic valve. And on the arch you would usually have 3 vessels, and the vessels would be the brachiocephalic artery, the left common carotid, and the left subclavian. They're not on mine. The superior vena cava is gonna be right around here where it would exit, and I'm sorry, this would be the inferior, and then the superior would be the top of it, which would be another hole. So it would go actually through the heart. Mine won't come out the other side, but I know it's supposed to. So inferior, superior, superior, inferior. The coronary sinus is, I forgot where that is. I think it's right here. Am I right? I don't know. I think I'm gonna miss that one. Where is the blood in these 3 vessels going? Which heart chamber? So it delivers deoxygenized blood to the right atrium, and these are veins. Okay, next we'll be doing the internal view of the heart, and I'll do it this view actually. And okay, the pectinate in the inner wall of the right atrium would be, I can't see like that. Can you see?
I can't get
Oh, you can't see? Okay. The pectinate would be up here in this area. Mine's kind of falling apart. The myochondrium would be the thick wall, and the left ventricle would be the thicker wall, and the right would be the thinner wall. And the left is thicker because it has to pump blood into the body versus just the lungs. Point out the trabecular carne in the inner surface of the ventricles. So the trabecular carne would be here, and these are the inner surface of the ventricles. You could see them. The intraventricular septum is here again. It separates both sides. The bicuspid would be the area where it has 2 notches. I think it's better to see on here. Here's like one. I'm not sure what the other one is. And then the other tricuspid would have 3. I think I cut mine a little jagged, so they're hard to see. It was a little hard for me to find. The chordae tendae are the little cords you see in here. And the cusp of the valve are actually the bumps. The bumps here, they're what hold the valves together. The papillary muscle are the humps that you see. So the humps. The pulmonary semilunar valve is actually in here, and it has little flaps. Mine, again, I cut my thing a little wrong, but it would be like little flaps with this little hole. Maybe like right there is kind of what it would look like. Here's some flap for you. Oh, I'm sorry, that's the aortic semilunar valve. I had them backwards, I apologize. So the aortic is the one with the flaps, and the pulmonary is the is actually in the pulmonary trunk, which would be where one of the holes leads to. I believe this is the aortic trunk, so it'd be like almost in one of these, probably in this one, most likely. Usually leads up to the actual valve deep inside. That's it.